then, Mick. We've got a big list of questions, but I'm going to pass over to the students. There's some of them that are hoping to pin you down with some specific ideas that they've had. So I'll hand over. So guys, who would like to take it first?
Oh, go on, I'll go first then. I'm really interested in person-centered mirror exposure therapy, and I just wondered, Mick, if you'd had any research or any knowledge of this area.
I've never heard of it.
And if in fact you'd consider whether in the future it might become one of your tribes.
Wow, person-centered mirror exposure therapy, did you say?
Yeah.
Never heard of it. What is it?
So it's using, obviously, in a person-centered way, a mirror to help someone who's had either body dysmorphia issues or severe burns, or particularly my area of interest, amputees, actually regain their basically regain their self-esteem, help them cope with the new perception of themselves. And really help them prevent them really from dipping into quite deep depression, which some of them do after surgery.
Yeah, I'm just having a look on the web actually as you're talking, and it looks very interesting, and I can imagine it's very helpful. And exposure therapy generally has a good evidence base as effective approaches, and I'm sure, it looks kind of like the focus is on trying to make it quite person-centered anyway. Mm-hmm. But yeah, I can imagine it would engage well. Whether it would, whether it'd ever be a try. I mean, I'm sure people could practice person-centered therapy in that way and integrate it in a kind of integrated way. It'd be very interesting to look at. I guess what you'd want to look at is maybe case studies or people's experiences of that approach. What's really important, and one thing is so important with research, is that you have to go into it with an open mind. Mm-hmm. And the problem is if you think something like person-centered mirror exposure therapy is a really good idea, then that's not a good place to research it from in many ways, because it's so difficult to be kind of open-minded. You really have to be open to a client saying, actually, I didn't like it, it was rubbish. Mm-hmm. Without going, oh well, that's because it was this and this, and going, okay, that's interesting, and kind of taking it away. So generally what I say, one of the things I say, and I'll probably say it a few times this morning, is that when you're thinking about a research topic, find a question that you don't know the answer to. And if you're going and asking something where you want to show something, that doesn't tend to make good research.
That's a really top tip, Mick. Thank you. I've got a question that might follow quite nicely for that then. So with your research experiences and the areas that you've looked into, have you taken your own advice with that and always asked those questions, or are you a little bit of a devil's advocate with it?
No, actually, I think I have. I mean, I think about that as a very good question, and I'm certainly not perfect, but I started doing research. I mean, I started researching person-centered therapy. Is it a person-centered course, Kerry?
Yeah.
Okay. So I started researching person-centered therapies in the 2000s, and I was existential and person-centered trainer. I was very committed to the person-centered approach. I wanted to show, and I think my underlying assumptions was that we'd show that person-centered therapy was very effective, more effective than CBT, better in the long term. And I think I was not. I mean, the book that I did on kind of like the facts are friendly was a really important piece of work for me, because I really had to trawl through the evidence, and it just didn't support what I wanted to believe in. I saw really good evidence, like we were just saying before, about exposure therapy. I started off, I didn't want to find that was effective. I'd much rather the research showed it had very limited short-term effects. But actually, I kind of felt like I had to challenge myself and be open and say, okay, actually, the research is showing it's open. And then some psychodynamic. I don't like psychodynamic therapies much, but I have to remind myself that actually, when I look at the evidence, that it does pretty well. And in our ethos study that we've just done on school-based counselling with kids, I wish the person-centered counselling had done a bit better, but it didn't. And I wish it had been more cost-effective, and it wasn't. And we wrote it up in that way, and you know, sometimes the way I talk about it, I might talk up some of the kind of more positive sides than the negative, but I think I've been fairly open to counter hypothesis findings, and I think that's really important. I don't think it's research. You know, the whole pluralistic, I mean, people think, you know, you can say, well, you know, you have pluralistic therapy and, you know, now you're finding evidence to support the idea that lots of different things can help. But pluralistic therapy emerged really on the basis that the evidence just didn't support any one purist form of therapy for everyone.
Yeah.
I wish it had done. And I know what my agenda was, you know, and it was against what I wanted to show.
So when you're talking about the types of research you're doing, then does that mean that there's a particular type of methodology that you chuck into Room 101? Because if you had to get rid of an approach, if you will, or is there an approach that's particularly good or bad?
Do you mean in terms of method?
In methodology, yeah.
Therapy. Method, I think, you know, I think all methods have got a really valuable role to play. I think that, you know, they answer different questions, and I'm a real pluralist when it comes to method. I've done RCTs, which is about, you know, my work has ranged from the kind of most stringent positivist-based RCTs, experimental studies with, you know, like this ethos one with hundreds of kids, to very reflective kind of qualitative analysis. I'm doing a consensual qualitative research study at the moment. I come from a phenomenological background. I wouldn't put it in 101, but one wish, if you like, was that I wish in the therapy field there was a bit less very self-reflective, autoethnographic, heuristic studies. And I do think those approaches are really useful. And I'm not against those approaches per se, but it concerns, and this is a kind of soapbox, but I do just worry that a lot of students end up researching themselves. And of course, we're all interested in ourselves, but I just, you know, there's so much, like students here, there's so much you can do if you talk to clients. I mean, I don't know what the ethical requirements are. I know on some courses it's difficult to do that, but, you know, when you've got the choice between, say, asking therapists and yourself, what is your experience of, say, empathy versus clients? I just wish there was more students going out and talking to clients and finding out what clients really make of it, because I think that's where the learning is. And I think that, you know, we tend to regurgitate a lot of our theories and what's really interesting to me, and I think to the field and to policymakers, is what clients make of stuff. So if you can talk to clients, I think that's, you know, those things that are like client helpfulness interview studies where you're talking to clients, just really simple studies. What was helpful? What wasn't helpful? I think those are wonderful studies, and I think for me personally, I think they have more value to the field than.
I think that's probably very reassuring to everybody here today who's been having some real challenges reading quantitative research as well. If it means that the qualitative research has a value, it means that they don't have to get their heads around the tables and the codes and the it's going to make it a little bit more simple too.
Kerry, I think that has a value as well, and I think that, you know, I know quant stuff can be really difficult. I mean, you know, a lot of people come into counselling without that kind of statistical training, mass training that you need, but it is very bad, you know, and we can't understand everything. I think that's very bad. You know, the stat stuff tells us about averages, tells us what on average works for people as a whole, what is cost effective for people as a whole, whereas the qual stuff tells us about people's experiences and how people kind of experience that on a more individual level. It tells us less about, say if you wanted to compare something like men's and women's experience of person-centered therapy, you can't really do that with qual in a way that you can do with quant. So I think they both got a really good place, and there's just, you know, there's a real value in all of that.
Oh, thank you. Right, I'm going to take the time now, guys, just to pass it back over to you and just think about what Mick's just said, following on to your questions that you wanted to ask. So opening up to the floor. Who wants to go next?
Yeah, I'll go next if you can hear me. Can you hear me?
Thanks for it. Yeah, go for it, Heather.
Okay.
Hi, Heather.
Hi. Yeah, because of COVID, a lot of us have moved on to online counselling, but I find that the research is very limited. So I was going to ask you what research you think might be useful for online counselling to move it forward.
This is a great question. We had a little bit of research. I think there is quite a bit of evidence on online online, certainly online therapies, and comparing online work, not so much prior COVID, with face-to-face, showing that it can be really valuable. And we've had studies, Terry Hanley, for instance, has done work about the alliance in online therapy, showing that clients often feel quite a strong alliance, as strong as face-to-face. We had an interesting study by Ashley Trina looking at relational depth in online therapies, and finding that clients did actually experience quite a lot of, or could experience quite a lot of relational depth. And there were some factors that meant that it was more difficult than in face-to-face, like the physical distance, but other things that actually could facilitate it, like the online disinhibition effect. I think there's qualitative studies talking to clients about what's different groups of clients or clients in different situations, what's helpful, not helpful about online therapies, can be really useful studies in building up a kind of database about what we maybe need to know about what are the most effective ways of delivering therapy online. Quant studies as well, looking at the effectiveness of particular therapies online, person-centered therapy online. You could do some good quant studies about that, but those are bigger studies. And I think certainly qual studies, just talking to clients who've had online therapy about their experiences, would be really helpful.
Thank you.
Can you hear me okay? I think you've frozen, Heather.
Yeah, no, I can hear you. Yeah, thank you.
Thanks very much for that, Mick. So well, going back to
my cat's harassing me. I'm just going to let her in. You carry on. I can hear you.
Wonderful. Well, it's nice to know. What's your cat called, Mick?
She's called Bonnie, and she's not very friendly actually. She's one of these cats that kind of. Can you see her?
Oh yeah.
You're going to say hello, Bonnie.
So you guys, we've met Nick Cooper's cat as well now. I mean, how many people get to do that?
I don't think she likes you very much, actually. Anyway.
Oh. Well, going back to what you were saying about these research skills and the fact that everything has a value, what would you consider? So obviously, we're all trainees here. We're at the beginning of our careers. What would you consider the strongest skills for both counselling and being a researcher as a counsellor, and how or why are they valuable to you?
Well, I think as a counsellor, I think the strongest skill is the ability to listen and listen deeply, and to really, I mean, whatever counsellor you are, whether it's person-centered, psychodynamic, CBT, I think that ability to kind of clear a space where you can really hear somebody, not just in a cognitive way, but in an embodied way, in the sense of kind of getting a felt sense emotionally of where someone's at, and being able to understand the world through their eyes. I guess we're talking empathy, but of course empathy in a kind of accepting way. I think that's a critical skill for all of us to learn, and that's not that's the only thing that you do. And I think as a counsellor, you draw on that, and then how you reflect that back to the client and help the client explore it, and asking questions, and all those skills also really important. But it's got to start from that ability to be able to enter into the client's world and really understand their experiences. And I think particularly for qualitative research, those are really key skills as well. I mean, obviously qualitative research is a different thing, but really good qualitative research is again about putting our own prejudices, assumptions, biases, expectations, hopes to one side. Not that it's bad to have them, but just to be able to bracket them, so that we can really hear what our participants are saying about their experiences, and being interested in those experiences per se, and not trying to, as I was saying beginning, not try to prove something or show something, but really genuinely being interested in what clients experience above and beyond what we might expect it. So I think it's the same thing, is that kind of that ability to listen, engage, be interested in the other's world.
Thank you. That's a really great point, especially when listening is a skill that's so transferable between counselling and research. I think a really valid point there. It actually links to one of the students' questions. Jake, is now a good point for you to go through your question?
Yeah, okay. Hello, Mick.
Hi, Jake.
Okay, so I've got so what do you think needs to be done or occur so the counselling profession is better recognised, particularly the person-centred approach compared to CBT and medical professions, by organisations such as NICE and the NHS, so that plucky students like us have better chances of employment post-qualification?
Yeah, great question. Well, I think more research. I think that And I think more research that genuinely engages with how these health organizations see things. The reality is, I mean, we can say, you know, we can value qualitative research, and they're not against qualitative research, but they're just never gonna, I don't think they're ever gonna put qualitative research at the top of their research tree, because what they're interested in is overall average effects for a particular treatment for a particular population, and it's very difficult to generalize that from, say, individual case studies or small scale qualitative research. But I do think so. I think one thing actually that would be really helpful for that is for people in the kind of person-centered humanistic field to think about how might you translate small-scale research into policy, because I think that's one of the reasons why it's never really happened, is because it's really not clear how you would do that. So some thinking on that, I think, would be really helpful. But I think people from the person-centered humanistic field just have to take more leadership and develop into doing large-scale pilot trials, studies, experimental studies, RCTs, where, for instance, they're comparing, say, for people with bereavement, the effectiveness of person-centered therapy against other therapies, maybe, or looking particularly, I mean, we know that, you know, different clients do different things, so looking at the particular clients that might benefit from person-centered therapy. I mean, in my experience, talking to kind of the civil servants and the people who develop NICE guidelines, these are people who care passionately about the well-being of the population, and they're working really hard. And I don't think that they have any particular biases against person-centered therapy, but it's just when they're writing these guidelines, they want to treat the evidence fairly. They're not willing somebody just to say, well, my therapy is best. They understandably, I think, because anybody can say my therapy is best, I think they understandably want to see rigorous evidence to support that. And I think the onus is on us as a community to develop that evidence. And it's a challenge because, you know, the reality is that a lot of us come into areas like person-centered therapy because we're interested in people's experiences and qualitative experiences rather than numbers and statistics, but kind of someone's got to do it. And there isn't a big body of researchers out there thinking, oh, I wonder if I'm going to go and research person-centered therapy. They research cognitive behavioral therapies because it's more aligned with the kind of psychologies that they've been learning. There's nobody else who's going to do it if we don't do it.
That's a really good point, and it actually links a little bit to what you were saying about the listening element as well. Does that mean that you think that, well, what does that mean about the research skills that you think are really important? And is it mostly about objectivity and having that, or is it good to have that specialized knowledge? Well,
I think, you know, I mean, it took us, this RCT that we did, this randomized controlled trial, took us 3-4 years, enormous amount of money. I think it'd be very difficult to do that without being established at a university. You know, so I think for students, something like that is difficult. But, you know, if you're doing a master's, doing a PhD in the field, then it becomes possible to maybe do a small scale pilot looking at a particular group of clients, and developing some of those kind of statistical and numerical skills. And I think if people hate it, of course, you know, people hate numbers and hate maths, then there's no point trying to go down that line. But I think what people can do is that those who are kind of more familiar or like those things to really develop those skills, and also for other people to support it. You know, I think if it felt like the person-centered community was supporting that research, I think others would be more positive about it. Often it feels like there's quite a lot of hostility, and that's fair enough. I understand why people are very skeptical about that. I mean, you know, people are wary about experimental trials for lots of reasons, but I think the person-centered world has got to make some choices about whether it, you know, tries to support this, tries to go forward, or whether it says, look, we just don't want to be involved in it. And ultimately that might be the best way forward. It might be that if we just hope that it goes away, it will do, but that's not my sense. You know, it's not my sense, because I think the health field has its own rules, and part of listening and understanding is appreciating that it's a different world, a different discourse. And you can't critique the medical field for having a medical, well, you can, but I mean, you know, the medical field is going to have a medical model. That's where they come from, and I think understanding that and engaging with that is more person-centered than kind of standing on the sidelines and complaining.
Very interesting point. So just conscious of the time. So is anyone else wanting to get a question across to Mick whilst we still have him? Jill, I can see you're lit up. Jill, was that you or was that you, Deb?
I've got a question.
Go for it, Deb.
Okay. I don't know whether it's actually going to be relevant, but I was just wondering how therapy could help people with chronic pain, and have you published anything on this subject matter?
Oh, we have actually got a PhD student who's doing some work, Diego, who's doing some work on interventions for chronic pain, and he's done some really interesting reviews and then analysis of interviews with clients. Were you saying about person-centered therapy with chronic pain, or just chronic pain generally?
Within person-centered remit,
Yeah.
I mean, I suffer from chronic pain myself, and I've gone through the pain management program, but it was more CBT based.
Yeah.
So I was wondering if there's anything more person-centered.
Yeah, that's where it'd be so interesting, for instance, to do quality interview study, maybe talk to some of the clients who've had person-centered therapy for chronic pain, go into it with a really open mind and just ask them what was helpful and what wasn't helpful. John McLeod and I did something called client helpfulness interviews, which you can find on the web, which is just a kind of protocol for, or just some thoughts really about how you might ask about helpful factors and unhelpful factors. And I think a study which genuinely, you know, without trying to show that person-centered therapy was effective or not effective, was just going to talk to them about what they like, maybe about person-centered therapy and what they would wish to have been different, would be so useful. It wouldn't prove that it was an effective therapy. I mean, again, for that, you'd need kind of bigger randomized controlled trials, but it would be so helpful. Because I think, sorry, something I haven't said is that, you know, I think one thing that we can do in the person-centered field that's helpful is to do bigger studies that show the effectiveness of work, but it's also about genuinely developing our therapy. And I think one of the problems with the person-centered approach is that it says it is quite clearly defined, and it says, okay, there's these 6 conditions which are necessary and sufficient for change. And that's really helpful in terms of training people and in terms of developing skills. But in terms of the basis for research and in terms of developing a therapy, the problem is that it doesn't give you much flexibility, or actually paradoxically opportunities for growth in terms of the therapy itself. Because say we interview people who had chronic pain and said, you know, I really like person-centered therapy, but I wish the therapist had given me some homework. So they say something like that. You know, if we say, well, okay, but homework's outside of person-centered therapy, then we never really learn from the evidence. Whereas I think if we can be open-minded, as I think Rogers really encourages us to, and, you know, he talks about the facts always being friendly. If we can learn from the research and not just say person-centered therapy is these 6 conditions, but person-centered is about a spirit of openness, learning, growth, flexibility, fluidity, then I think that's a much better base for developing the therapies. And you know, ultimately it's not just about proving person-centered therapy as it is effective, because nothing that was developed 50, 60 years ago is ever going to be, it's like kind of having a drug from 50 years ago and trying to keep on banging on that that's the best drug. I mean, things change, research change, things evolve, people learn more, and unless we're able and willing to incorporate new research and new findings and new evidence, I do worry that person-centered therapy will go the way of the dinosaurs.
I think a very thorough answer. Mick, thank you so much. I've got 2 things that I would like to request before we leave you to your teaching, if that's okay. The first one is, given you've been able to join us this morning, thanks to a lot of the circumstances around remote learning now, do you think that has a value, or what value do you think that has?
What, remote learning?
Oh, well, the value of you as a guest speaker or an industry expert being able to join sessions thanks to remote learning.
I have no idea. You're going to have to ask the students that if you want to do research there in that, Kerry, you're going to have to talk to the students. So
okay.
Well, having Mick here for half an hour was a complete waste of time. my view on it, that's like asking a therapist what they think of therapy. My view on it is pretty irrelevant. But let me know what your students say.
I will certainly pass that on. Well, then I suppose the last request for you then is, guys, if you could all get together, I think it would be really lovely to have a big photo showing Mick what we think of having him join our session this morning. So big smiles, I'm assuming, all around. Jake put his lucky on special, so make sure you're all cheesing. Everybody looking forward, and I'll take a screenshot. Cheese!
Cheese!
Thank you so much, Mick, for joining us. And I certainly will pass on. Guys, do you want to let Mick know what you think of having a guest speaker join your session for the morning?
Yeah,
it's been great. Thank you.
Fantastic. Thank you.
Thank you. Nice to talk to you.
Take care. Stay
Bye-bye.
safe.
Thanks.